Hello and welcome to the online introductory session of the Academy of GP Orthodontics. I'm Milton Dragatakis, I'm one of the instructors with the Academy, and today I will take you through a series of slides that will explain to you who we are as an Academy and also what to expect in our 12-session comprehensive courses. So here we go. For most of you, today is part of a journey that you started a long time ago. You have worked really hard, you have earned your degrees, and most of you have established your practices, and congratulations for that. So the question truly is, why strive for more? You've had so much success already, why start a journey of continuous education, especially in the field of orthodontics? The answer could be the fact that your patients deserve it. Maybe you're seeing yourself lacking certain areas that you want to improve your knowledge and expertise. For others, it may be that our practice depends on it. And by that I mean we may have a lot of orthodontic requests or live in a community that we don't have enough support in the orthodontic arena, whether because we practice in a very distant, remote area, or whether we don't have any orthodontist around us that we can refer. Regardless of what your reasoning is, the truth is that your income is directly proportionate to the value of services you provide for your customers, for your patients. So improving in an area of continuous education is similar to what the telephone companies did for the last 20, 30, 40 years, especially as it relates to cell phones. Just because we established a method of communication with each other did not stop us from always asking, is that all we can do? And as a result, we have now beautiful cell phones that we carry around that have access to our emails, the web, and a whole slew of functions that are possibly replacing, for some of us, the use of a personal computer. So these are all great reasons for you to embark on this journey, but please see it as a journey. Continuous education never stops. And even though for most of us we have a clear destination we want to arrive, the truth is that we have to become lifelong learners. And that doesn't stop when you graduate dental school. It doesn't stop when you open up your practice. And for some of us, doesn't even stop when we retire. So keep learning, and I'm so glad you're here. Now, knowing that we will be lifelong learners, the next question is, why study orthodontics? What is so unique about the field of orthodontics that may be enticing or attractive for someone to attend? For me, the biggest reason is that it's the least invasive way to a beautiful smile. And with that, I mean, there are so many other ways you can actually create a beautiful smile with veneers, crowns, implants. But the least invasive way, we all have to agree, is the practice of orthodontics. Not only that, it does affect most areas of dentistry. If you go back and look at a lot of scenarios you had in other areas of dentistry, orthodontics could have played a positive role. For example, in the patient's occlusion. Their bite is directly related with how the teeth are positioned, and a lot of malocclusions may lead to significant wear that impact a lot of the well-being of the patient's dentition. Even if you look at growth and development, how do you deal with a situation where now the teeth have erupted in such a position that creates a problem for the growth and development of that particular child? In this example we see on our slides, we have an anterior crossbite that without orthodontic intervention, it will be very difficult to be corrected. Restorative dentistry is also impacted by orthodontics. Take, for example, the x-ray you see in front of you. How would you restore a tooth that is leaning so far forward with the periodontal pocket that has been created between the molar and the premolar? The answer is you can't unless you orthodontically reposition those teeth. Periodontics is definitely an easy one. In that particular same example, imagine the periodontal implications of that mesially inclined lower first molar, and then obviously the airway related symptoms are directly related to the position of the jaws and even the constriction or expansion that we may be able to achieve through an orthodontic treatment. So as you can see, orthodontics does have an impact in every area of dentistry. So that's a good enough reason to say, I'm going to start with a solid foundation of what orthodontics can do for me and my patients. The question is, even if you know you're starting to be involved in an area of orthodontics, you have a big problem. And that's not just a problem for me or for you, it's a problem for everyone who's graduating even today from dental education. And that problem is that dental schools do not prepare us properly to treat those orthodontic malocclusions. And the second problem is that our patients are actually expecting us to provide proper diagnosis. As you can imagine, when you have not been properly prepared, but you're sitting in front of a patient who expects you to know the answer to their problem, you have an issue that will be very difficult to resolve. The third one is that even if you try to come up with different treatment plans, your treatment plans will end up being handicapped. And that's because you only know what you know. And you won't be able to provide options that may affect or be more beneficial for that patient if you don't know what could be done for them. Obviously, the easy solution would be to refer out every orthodontic problem. But that's a problem in itself, especially for those of you that are working in areas where you don't have a lot of orthodontic options. Who tells you that your local referral recipients are adequately trained to handle your patients? And I know you may assume that for someone who finished even an orthodontic residency, they should have a firm grasp of what orthodontics can offer, but don't kid yourself. In your dental school class, there were many graduates that you yourself know you wouldn't trust your mouth in their care. So referring out every orthodontic problem does not necessarily solve every issue you may have with the patients coming back to you at a later time. So orthodontic incompetence, how I call this problem for you, may lead to limited control. And even if you hire an orthodontist, you are subject to those orthodontists' preconceived philosophies, treatment plans, and training. So the question for you is this: do you want to remain incompetent? And again, that's not an answer for me to decide, but that's an answer for you to realize before you embark on this long journey studying in the field of orthodontics. Now, thankfully, there are some big solutions. The first one being, quit your practice and go to orthodontic residency. This is by far the most popular solution that even orthodontist friends of you may be able to offer you. They will say something like, go get your specialty certificate. You'll have actual patients to treat. And they are correct. Going to the orthodontic residency training will give you a lot of answers and the time for you to immerse yourself in the field of orthodontics. But there is a problem. You have to give up your income and your practice and take a pretty high loan, in some cases $80,000 to $90,000 a year for the next 2 to 3 years. So the question is that practical? And for most of us, that is not. So then you are resorting to a second option, which is continuous education. Continuing education is a great tool you can have because it allows you to maintain your income and your practice. So it seems like you're getting the best of both worlds, right? Because you can maintain your practice, your income, and immerse yourself in some form of continuous education courses that will give you the necessary knowledge you need to advance your career. Well, the problem with most continuing education courses is that you don't actually see any patients. So instead, you resort to a type-O education and you have limited mentorship at best. You show up to elaborate, extravagant seminars that may give you 300 pages worth of handouts, only to find yourself alone Monday morning, trying to fit bands or place brackets on a case that you don't really understand the true diagnosis and you don't have anyone right next to you to mentor you along the process. So we have a huge gap between that solution, number one, and that option, number two, that may lead you to say, can someone bridge it? Well, I'm happy to say this is where the Academy of GP Orthodontics comes into play. The Academy of GP Orthodontics came in to bridge that gap and create continuing education courses that actually have you treat actual patients and provide for you the mentorship you need for your career. I believe that for those of you that have heard the history, this was the reason that it was started by Charles Yates. Charles Yates was a Dallas area pediatric dentist. In 1968, he established the Dallas Orthodontic Study Club, and then in 1974, he was one of the founding directors of the American Orthodontic Society. But all courses they were offering up until this point were Taiwan-based. He understood the gap in that critical education and formed the Academy of GP Orthodontics in 1987. The AGPO is the first and only academy to offer a 2-year comprehensive course with a hands-on component, and that's a component that you actually, the students and dentists, are treating actual patients in a clinical setting. I believe that made all the difference in the world. Why? Because first, you get this education, that clinical education that I call the Trifecta of Education. You get that didactic information. That is the know part of the academy. Our lectures are second to none. Our instructors have spent hundreds, if not thousands of hours educating themselves in what constitutes as a necessity or a necessary information for you to apply in your practice. But it doesn't stop there. After the know, you have the actual do. You have extensive hands-on clinical experience. That's where we get into our clinics and we treat actual patients so that we get what we learned on Friday and actually apply it on patients on Saturday. And it doesn't stop there either. Beyond that, you have this exceptional mentorship network that as a member of the Academy of GP Orthodontics, you have available to you. And that starts from the weekends we meet, but extends in virtual support even for your own patients, treatment planning, diagnosis, and even along the way being able to collaborate with your mentors to troubleshoot problems even for cases that don't go really well. That's a huge advantage, an advantage that some other academies may charge thousands of dollars just for you to receive. So, knowing that, here's a few words about our course format on Fridays. We start by giving you all the didactic information you need, and part of the online courses will be able to do that. You get all the course material and the definitions, the diagnosis you need, so that you know really well what goes on behind the scenes. We'll go through medical and dental history, extraoral, intraoral exams, how to take great facial intraoral photographs, how to analyze the panoramic radiograph, most importantly for orthodontics, the lateral ceph. Analysis of cephalometric x-ray is critical for orthodontic diagnosis, and also evaluate your study models. So this all happens on Friday, where you are able to basically clinically diagnose and treatment plan your case, even from home. But then on Saturday, we get to take all this knowledge and now apply it in clinical experience. This is the do part. We get to bond brackets, place bands, fit arch wires, attach all the elastics, monitor the patient's progress, troubleshoot what may have not gone as well, all the way up to finishing our cases, fabricating retainers, and even training your assistants. For those of you that are enrolled in our clinical courses, occasionally, time and space permitting, you may be welcome to bring your assistants so that they can actually see how an orthodontic office is run and basically be trained without you having to tell them everything you learned the weekend before. And overall, we're having fun. Our settings, our classes are very tight-knit. We try to keep the number really small, intentional, so we can have a direct interaction and kind of monitor your progress along the way. But it's all about transferring what we learned Friday to what we are actually doing on Saturday. Now, I want to take a minute and discuss a few of the bracket options that are out there, because when it comes to brackets, nothing has been more misleading than people believing that a single bracket is the answer to their orthodontic problems. And the truth is, I have a couple of principles that have proven right throughout the years. Principle number one is, it is not about the bracket. So I don't care what bracket you're used to or what you have in your practice. I don't care what prescription you have. Guess what? It is not about your bracket. The fact that your orthodontic case worked really well does not depend on the type of bracket you used. It depends on your knowledge and expertise. So my second principle is, even though it's not about the bracket, the important thing is for you to know your bracket. There is no excuse than using something that you don't know its prescription or application in its entirety. So yes, I don't believe that a single bracket is a solution to every problem, but I do believe that the more you get to know your bracket, the better treatment results you will have. With that being said, there are different types of slot heights, and most brackets are categorized between an 18 and a 22, what we call slot height. When I say 18, I mean 0.018 of an inch in height, and a 22 is a 0.022 of an inch in the slot height. The most common being the 22-inch brackets, and those are the ones we use in our courses. Now, when it comes to prescription, you have a lot of prescriptions out there. The MBT and the Roth prescriptions seem to be the most popular at this point. Our bracket we use for our class is the Tip-Edge Plus bracket, and it's a 22 slot bracket with as close to a Roth prescription as possible. Again, it's not important for you to know what bracket as much as to know how well we will apply its unique characteristics in our treatment. So for consistency, Peter Kessling developed that bracket, and we will go through the unique characteristics of it, the deep tunnel, the vertical slot, and how we can use those to finish our cases. It's an exceptional bracket, but again, remember my principle number one. It's not about the bracket. It's how we will learn the bracket and apply what we need for our cases. So as a result, if you end up to have already been working in a practice that does not use that particular bracket, don't let that deter you from taking our courses, because the mechanics, the applications, the diagnosis, the treatment planning will all be the same. Okay? With that being said, we will have a textbook, and for us that will be the Tip-Edge Plus guide. In our courses in Ohio, also use the Contemporary Orthodontics textbook as well. But for the sake of consistency, we start with the Tip-Edge Plus guide written by Peter Kessling, and it will teach us the differential straight arch technique. That technique is a systematic approach to learning, and that, especially for those of you starting just now, is very important to have, because as you start with the ABCs of orthodontics, as you start with brackets and how to go from stage 1 to stage 2, it's important to have a system that will tell you what to do where you are as you're learning the principles that will make you better and better in your career. So that systematic approach develops basically 3 stages of treatment. Stage 1 being the alignment and leveling, stage 2 being the space closure and the bite correction, and stage 3 being the finishing of the case, which may include a final tip and torque of your teeth. Now, keep in mind, those stages are applicable to any other technique or bracket. If you don't believe me, you can actually look at the Contemporary Orthodontics book by Profit and look at chapters 14, 15, and 16, and you will see that he develops and explains the stage 1, 2, 3 approach the very same way that Peter Kessling develops it in his book. There are some differences based on what bracket we may use and how many teeth we bracket to start the case, and all this would be explained throughout our 12 sessions of comprehensive courses. But the staging will be that systematic approach we will use throughout treatment so that you can basically control your thoughts and progress as your case unfolds. Okay? So if you're ready to start, here's our phone numbers. You can call the Academy if you have any personal questions about anything I discussed today. You can email me directly at Dr. Milton at Cornerstone Dental CE. And I hope to see you again for our future online courses, and even better, our 12-session comprehensive course. Thank you for being with us. Have a great day.